Okay, I entered the station, and I am Dr. Kurutilan. I am the candidate here. This is my mark sheet, sir, and I'm going to examine this child.
Just hold. Okay, Dr. Kurat, you have to examine Andrew. Andrew is 6 years old, and you have to do his abdominal examination.
Okay, Andrew, I'm Dr. Kurutilan. I'm going to examine you. Is that okay with you? And Andrew is accompanying
Yes,
with
doctor.
any caregiver. Andrew,
Hello, doctor. I'm Andrew's mom.
okay. Mom, is it okay? Can I examine Andrew tummy?
Yes, go ahead, doctor.
Okay. There is in Andrew, there is any device or any dysmorphic features?
Not attached to devices. His face looks round, and there is periorbital puffiness, and cheeks are full
Yes.
and and red.
Okay. There is any distress?
Yes, some distress is there.
Okay. What about the height and weight of the child?
Weight is on 90th centile and height is on 50th centile.
Okay. Okay. And Andrew, can you show me your hands in front of me so I can see there is any pellar
Slight pallor
in the
present.
hand? Slight pellar present. Can you put your both index finger up and down and unite together so I can see there is any clapping or not?
Clubbing not present.
Okay. There is any cannula marks present in the hands?
Not present.
Okay. Can you stretch out your hand so I can see there is any flapping tremors?
Not present.
Okay. And I inspect the hand inside to see there is any palmar arrhythmia.
Not present.
Okay. Can you put your lower eyelid down and look upward to see there is any pellar?
Pallor present.
Okay. Can you put your upper eyelid up and look down to there is any jaundice?
No icterus.
Okay. And can you open your mouth? What about the oral cavity? There is any oral ulcers?
Good oral hygiene. No oral ulcers.
Okay. Can you remove your shirt, Andrew?
Yes. Removed.
Okay, thank you. I'm going to inspect the abdomen from the foot end, from the lateral end, from the above. There is any scar mark, any abdominal distension,
Abdomen distended.
abdomen distended. Okay, and now I'm going to. There is no any scar marks present.
No.
Okay, I'm going to palpate your abdomen. If you have any pain anywhere, Andrew, please let me know. I will stop it. So I will do the superficial examine in the reverse of 9 from the right iliac fossa to the left and going in the upward direction, reverse 9. There is anything on the superficial examination.
Nothing there.
And with the same manner, I will do the deep palpation of the abdomen. There is any finding?
No. What you are
Okay.
looking for?
Or any mass or anything like finding.
No.
Okay, I'm going to inspect the liver. Can you breathe in, breathe out, and gently from the right end? I'm going
Not
diagonally to
palpable.
not palpable. Okay, I'm going to inspect the spleen diagonally, or spleen is palpable.
Not palpable.
Okay, I'm going to percuss from the Zephyr sternum in the horizontal manner till the umbilicus, and from the umbilicus to the laterally. There, what about the percussion note?
Percussion note.
What is shifting dullness? Sorry.
Shifting dullness present.
Okay. With putting the hand on the umbilicus, I asked Andrew, can he put on the lateral side for a few seconds, and then I again the tap again. What
Fluid
about
fill
shifting?
absent. Fluid fill. You are looking for fluid fill absent.
No, I'm checking the shifting dullness. I put the hand still on the umbilicus to for a few seconds and tap again to say check the shifting dullness.
Shifting
Will
dullness
you?
present.
Okay. Okay, Andrew, can you circle? I asked the mom to put the hand in the center twice and flicker it to see if there is any fluid trail.
Not present.
Not present. Okay. I will put my left hand below and the right hand up to see there are any kidneys on the right side on same manner the left side it is
Not
dilated.
palatable. Not palatable.
Okay. Okay. I will see auscultate the gut sounds. Uh,
Present.
present. Okay. I will check the pedal edema. Pedal edema is present.
Present.
Okay. I will check the sacral edema. The same manner. The sacral
Present.
edema is present. Okay.
Present.
And I will check the lymph nodes and cervical lymph nodes in
No
the
lymphadenopathy.
no lymphadenopathy. Okay. Thank you, Andrew. And I think my examination is complete. Today I have
Okay.
examined a 6 years old Andrew, which has a slightly pellar, and there is no cyanosis in clubbing, the spatial edema with present and with distended abdomen with no scar marks, and the height is slightly mild tachypnic, and superficial deep examination is unremarkable unless there is a fluid shifting governance is positive and fluid trail is negative. There is a pedal edema, sacral edema. The height is 50. The height is a 90th
Three
centile
minutes.
and 50th centile. And in order to complete my examination, I would like to take the blood pressure of the child and want to do the bedside urine depth check also. So by compiling all this, my diagnosis is a case of nephrotic syndrome. It can be. And
Okay. So how you will confirm your diagnosis? Is there any other differential in your mind?
a protein losing enteropathy.
Okay. So how, so suppose Andrew is having nephrotic syndrome, so how you will confirm your diagnosis?
I will do the bedside urine dipstick test, and I will send the check the blood pressure also, and I will do the protein creatinine ratio. And for the other test, I will do the 24 hours urinary protein, and I will check the baseline investigation, also the food blood count and the cholesterol and the triglycerides also. And I will do the detail of urine DR, also urine culture, and the ultrasound of the abdomen to rule out the renal venous thrombosis also.
Okay. So anything else?
Uh, I will do the investigations for the complications also, like ultrasound of the abdomen also, and the complement levels, and
Okay. So how you will manage Andrew?
uh, I will to do the detailed examination and take the full detailed history, and will involve my the senior also with the help of the multidisciplinary team approach with the central role by the pediatrician with the nephrologist also, and and I will involve my senior with the consult. I will start with the after the confirmation. I will start the prednisolone with 60 milligram per meter square for 6 weeks, and along with that we have to monitor the weight also, and blood pressure also weekly, daily blood pressure and weight daily if the child is admitted, and to keep an eye on the urine output also.
So we have to give 60 milligram prednisolone for 6 weeks and then stop.
No, we have to taper off them gradually.
Okay. Right. Anything else? So what advice would you give to mother?
If there is a if there is blood in urine, if there is uh, abdominal distension is not improved and the swelling
Time
become
over.
worse.
Thank you, Dr. Koda. Okay.
Okay, thank you, Dr. Manish.
So as far as physical examination, so exam technique lacking some structure. Okay.
Okay,
And
you tell.
limited adaptation to meet needs of parents. So you will be asking child, okay, Andrew, can you lie on the bed? Mom, can you help me in
Okay,
pulling up the shirt? Okay, so you will be interacting with with the mother and the child simultaneously, and you will be
Uh,
talking to the child also. Try to do it like this. So here you will be getting borderline
if
1 mark.
Dr. Manish, the child is 6 years old, then will we ask the child to do it by itself or with the help of the mother?
Yes, you can ask child also, but if child is not
Okay.
doing it, then you will be asking
Okay.
mother, because after all, mother will be there. Either mother or
Okay.
father will be there to help you out.
Okay.
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 And then in identification of clinical signs, you missed a few less important signs and some minor errors in interpretation of signs. Okay, so when you are getting shifting dullness, then why you are trying to go for fluid thrill? Okay,
Okay. Okay. If we get the
okay,
shifting
so
dullness, we don't do the
yes,
fluid thrill.
so there is
Okay.
no need to go with fluid thrill, and you have to look
Okay.
in inspection. What you have to look, whether the abdomen is distended or not, that you look, and then you have to. It is very important to look uh, at umbilicus, whether it is inverted or everted, because that will give you
Okay.
clue na whether there is some collection of fluid in peritoneal cavity or not. Am I making myself
Hmm.
clear?
Okay.
So that is
Okay.
important. Whether abdomen is
Okay.
distended or not, then you have to specifically look at umbilicus, and then you have
Hmm.
to look for any scars, any striae marks. You should have asked for striae marks. You have not asked. You have just asked for.
Okay.
Okay. So that
Okay.
you have to. So here you will be getting 1 mark, and then in clinical reasoning, uh, okay. So you could formulate diagnosis and differential diagnosis. So here you will be getting 2 marks. And then communication skills, rapport, and communication style. So there are some minor issues with level of confidence, and so so here also you will be getting 1 mark. So you will be getting 1, 2, 3, 4, 5 marks out of 8 if examiner is
So,
lenient.
Dr. Manish,
And,
what
and
is the lack of confidence issues? What you feel? Just can you tell me?
you should be fluent in asking for what you are looking for from examiner, from child, from mother. Okay, so just speak out. Don't be hesitant in speaking out.
Okay.
From
You mean
tomorrow,
like our
see, from tomorrow, you have to uncam yourself. You can cover your face,
okay.
but you have to uncam yourself, and then you have to present. And while you are asking me what to do, you will be showing me. Can you show me your
Okay.
hand like this? Can you you will be doing in the exam. You will be asking child to, okay, can you do like this? Can you do like this? Because
Okay.
otherwise child don't know na how to do it. You will be showing the child, and then child will be mimicking you. This is how it is done in the exam. Okay.
Yes. And what about the rapport building? I have to engage with the child more. You want to say this?
Yes, you have to keep on, hello Andrew, how are you? So
Okay.
in which class you study? Okay, so while you are examining, you will be talking to a child. It is, but keep in mind that in hand you will be looking for pallor, clubbing, cyanosis.
Okay. Okay.
That you will be doing subconscious. That when you will be doing, when you will be checking for hands, you will be checking for pallor, clubbing, cyanosis. You will be checking. Okay, but
Okay.
you
Okay.
won't be speaking out. But what you will be doing, you will be interacting with the child. This is how it is done. Examination is, this is
Okay.
how.
Okay.
Okay, but we
Okay.
try to
Okay.
speak out while we are practicing, so that we don't forget an exam. And the best way to do is that to practice on patient. There is no other way. This we are doing virtually, but if you do it on patient, then you will realize what I am telling. Then your whole perception of clinical station change.
Okay. Okay. Okay.
Okay.
Thank you, Dr. Manish.